I wanted to talk about the NICE program. It stands for Non-Invasive Caries Elimination, and just a little bit about the genesis of what we're trying to accomplish. And I think it speaks to the power of meetings like this. I think to the conversation yesterday with Micah from Tamaqua, that's a little bit of a mouthful, and how 2 years ago he just sort of had a random meetup with Ahmed Ismail, and what came out of that, this amazing program he's putting together, they're putting together collaboratively. And for me, sort of the genesis of the NICE program is something similar. So a couple years ago, I think 2 or 3 years ago, I'm just going to go through this. But my contact, my cell phone is in here, so and everybody don't feel special that you have my cell phone. Pretty much everybody in the state does. But I would encourage you. The slides are obviously available. I would encourage you, if you have any questions and you want to reach out to me, just feel free to give me a call. But the genesis of the NICE program was a meeting I attended a couple years ago in Alexandria, Virginia, with MISDA that you've heard a little bit about. And at that meeting, there was this crazy pediatric dentist from New England who had the chance to listen to and meet Johnny Norris, who was going to be the last speaker today. I would not only encourage you to stay around, but urge you to stay around and listen to his story, because what he said and what he will say today, I think, is transformational. I am so excited about this, I can't begin to tell you. So at any rate, he talked about how through the use of a non-invasive suite of services, he had built up a dental practice in New England. New England, very difficult from a Medicaid perspective, largely Medicaid patients, and he continues to build out his practice. He started in New Hampshire. He's now, I don't know why I'm talking about it, he'll tell you all about it. But it really did inspire me, this whole notion of changing the way we treat caries. So I went back and thought about what we at SkyGen, we administer the majority of Medicaid MCO dental plans in the state, what we can do programmatically. And I sort of thought about the problem we had with caries. So Sean had mentioned we have 3 million or so Medicaid beneficiaries in Pennsylvania. The majority are kids. I think the majority of children born in Pennsylvania are born into poverty. To me, it's abhorrent to even say that, but that's sort of the reality. And caries rates, and I've heard different people speak and different interpretations of caries rates. There's still a tremendous amount of caries there. In the dental world, caries and periodontal disease, again, when we're focused on kids, it's caries. So, I got out of dental school many, many years ago, and my degree, and I'm aging myself, is DDS, Doctor of Dental Surgery. The approach to caries has always been surgical. You numb a tooth, you remove tooth structure with this high-speed drill, and you place a restoration. It hasn't changed. We have the opportunity now to manage caries, I'll just say it simplistically, through medicine. We can preclude the need for the trauma of local anesthesia, and I just had a filling done, and nobody likes to sit in the chair and have a filling done. It's not the best experience. But for a 5-year-old kid, it's traumatic, and one of the issues that accrues from that is that we don't have, with the number of kids we have and the access issues that are well documented, we just don't have the drills. The old adage, we can't drill our way out of this crisis. It's really true. For a 5-year-old to come in and be treated to have a restoration done, a typical non-pediatric dentist will not have the ability to do that. It requires a great deal of behavior management skills. Some parts of the state, we have great access to pediatric dental care, Philadelphia being one of them. But in most parts in the state, we just don't have that access. So kids come in, and there's nothing to do with them, and there's no referral mechanism. Through this mechanism, through the use of medicine, through a non-invasive approach, non-pediatric dentists do have the opportunity to treat these kids now. And my contention is treat them definitively, not with an interim Band-Aid approach, but treat them definitively. So that's the program we're launching. It's called the NICE program. And it really was intended to be a bundled program that we would pay out through an encounter. One of my goals is really to move away from a fee-for-service mentality and look at an alignment of the provider with the payer around value, around outcomes. I don't think we do that at all. We struggle quite a bit with value-based programming, and Dr. Shamlou had spoken earlier about what was in there in the contract. Just from a dental school perspective, that's been a great, even that on a limited scale, has been very, very difficult to implement. So from a value-based perspective, the idea of having a bundle of services, and what we're talking about here are simple, relatively inexpensive services, all of which are covered Let me just advance this. All of which are covered under in the MA program. So we're talking about silver-diamine fluoride. We're talking about, you know what I forgot to mention, the other inspiration I had was learning about the Curaden product. And Vivardis is here, and I hope everybody had the opportunity or will take the opportunity to learn about this. Curaden is a product that gives us, for the first time, the opportunity to treat incipient enamel-only caries. So, you know, I had to think back to when I practiced, and it's been a while, but when we charted a patient, if a cavity was only into the enamel, we wouldn't treat it, you know, because there was this preclusion about doing anything to take away healthy tooth structure. So we would watch it. And I remember all over the chart there'd be WW, watch. And invariably, in many, many cases, those watches became lesions that were cavitated and had to be restored. Once you start that restoration process on a tooth, you are going down a slippery slope. You know, I just thought, in my case, I had an issue where, you don't want to hear the details of it, but I had a post build up in crown that came out. And the tooth's going to need to be extracted. Probably in my mouth for 25 years. I am certain, although I can't remember, that started with a simple, probably small interproximal restoration. Nothing lasts forever in the oral cavity. So if we can avoid in the beginning, you know, through this suite of non-invasive services. So again, we're talking about the Curaden. It's congruent with D2991. It is covered in Pennsylvania. Silver-diamine fluoride, glass ionomer, sealants, oral hygiene instruction, nutritional counseling, just to create a little bit of a bridge to what goes on in the person's home. I think we have the opportunity to really change the care paradigm. I am really, really excited about this. So we're launching this program, and it's been a very incremental launch. So we have a work group that was put together, inclusive of some folks at SkyGen, but also a lot of industry leaders. Helen Hawkey, and by the way, conference is awesome. Thank you for everything. Helen Hawkey's been a part of that, Dr. Shamlou, a number of others. So we've gotten a lot of different inputs in terms of what the program could look like. But we're now at the point where we want to find pilot sites. And I think there's, you know, the initial look at the program is going to be in the pediatric realm. I think there's great applicability in nursing homes for seniors. I think there's great applicability for special needs patients, you know, maybe as a prelude to OR needs. I think there's a lot of applicability for it, but just to get the program launched, we'll focus on pediatrics and on kids. And right now we're looking for pilot sites. So I want to have a variety of pilot sites. I want to have, obviously, a pediatric dentist, a non-pediatric dentist. I think the use of this program for mobile dentistry, I think mobile dentistry is, you know, again, something we need to focus on with the lack of brick and mortar offices in our rural areas. Mobile dentistry, certainly in a dental school, certainly in an FQHC. So we are looking for those pilot sites. We're about to launch. And what I'm hoping is, and obviously we want to be able to assess the data, because the value proposition for the providers, and we're creating some premiums around how we make the payments for those bundled services. We can't do it via Encounter because we just can't do it. So we needed to develop a program that was configurable and operational. We can't do it, so there's a different methodology. But we want to assess what the outcomes are. We want to assess basically care avoidance. And with that care avoidance, if we can utilize this suite of services and avoid traditional restoration and the cost of that restoration and share that upside with the providers, that's a value-based model, and that's what we've been lacking in Pennsylvania. So I am really excited about this. I think this can be change. Change is stressful. So we all know that, you know, whether it's positive or any sort of change is stressful. But we need to get buy-in. We need to have some courage on the parts of the providers. You know, certainly some buy-in from the MCOs in terms of funding. You know, again, I think there'll be, I'm just thinking about the triple aim that we talk about all the time, the sort of overriding desire to enhance quality. I think this facilitates that. To manage cost, I think this will do that in droves. To create a better experience for the member. You know, obviously, if somebody's going to come in with a lesion, different types of lesions, and just get stuff painted on, it can be done by auxiliaries, by the way, a much better experience than having a restoration. And then from a provider perspective, the stress of needing to do a technique-sensitive restoration in a dry field or on a child that's moving around, that's stressful. So I think that's, there's that for the provider as well. So we're just at the point where we'll be launching this program, and I'm hoping certainly within 2 years it will have impacts. I'd like to, be able to propagate this more broadly. But again, we are starting with a piloted approach, and we will take off from there. But again, I just want to encourage everybody. My inspiration for this was Johnny Norris, and everybody stay around, listen to him. I think you will be as mesmerized by his message as I was 2 years ago. So, and again, my contact information is on there. So somewhere it's on there. But so if anybody wants to contact me, please feel free. Thank you.